in Sudan's North Kordofan and North Darfur, amid escalating clashes between the army and the paramilitary rapid support forces. The United Nations International Organization for Migration has reported the war ongoing since April 2023 has killed over 20,000 people so far. Former Kenyan Prime Minister Raila Odinga was laid to rest with full state honors and a 17-gun salute at his ruler home on Sunday. President William Ruto and many dignitaries joined thousands of mourners with 4 public viewings, leaving 5 dead and hundreds injured last week. Namibia has declared an Mpox outbreak after confirming its first case in the coastal city of Swakopmund, as announced by local health minister on Sunday. Authorities have activated surveillance, contact tracing, and emergency response teams as the patient remains in stable condition amid active outbreaks in 17 African nations. An ECOWAS mission abruptly left Guinea-Bissau after President Umaro Sissoco Embalo allegedly threatened to expel the team that was working on a roadmap for the country's upcoming elections. The departure comes amid rising political tensions over Embalo's mandate. Gaza Civil Defense reports at least 45 killed in Israeli strikes on Sunday. The Israeli army resumes enforcement of the Gaza ceasefire while reporting 2 soldiers killed in southern Gaza. Ukrainian President Volodymyr Zelensky has said that Russian President Putin wants full control over Donetsk and Luhansk regions to demonstrate his victory in the war. Zelensky further added that Putin's goal is to show his dominance over Ukraine. Ukrainian President Volodymyr Zelensky has said that Kyiv is ready to supply drones to the U.S. if Washington provides missiles to Ukraine. Zelensky further added that a contract for 25 Patriot systems is currently in preparation. Thieves execute a 4-minute heist at Paris Louvre Museum, stealing 8 priceless jewels from the French crown collection. President Macron condemns the theft, pledging to recover the stolen works. At least 1,730 people have been displaced in Sudan's North Kordofan and North Darfur states due to escalating insecurity and ongoing armed clashes across the country. In a statement, the UN agency has said that its field teams estimated that 230 people fled from the Al-Mazroub area in North Kordofan last Thursday as a result of deteriorating security conditions. The IOM has said that 1,500 more people were displaced from the Abu Gamra area in North Darfur and moved to several locations in the Kornoi area in the state, where the situation remains highly tense and unstable. Now for this discussion, we are joined by Michael Atit. He's a journalist, joins us live from South Sudan. Thank you very much, Michael, for joining us. Welcome to NewsX World. Michael, what more can you tell us about this escalating violence in North Kordofan and Darfur? And what do you think, what does this reveal about the current balance of power between the Sudanese army and the RSF?
Thank you so much for having me. The report of the UN, even though it is a UN agency, but it could not reflect the exact number of the situation on the ground. It is very well known that the more than 2 years now fighting between the Sudanese military and the paramilitary rapid support forces has left the central Sudan, including the capital Khartoum. It is now focusing much westward towards the northern Kordofan and going to Darfur. And it is, to many, it is not a surprise because the focus of the war is currently in that region, and especially in the Kordofan, because the paramilitary is also trying to push eastward, coming towards Kordofan. Meanwhile, the military is trying to push westward. So the Kordofan now becomes the central ground for new battle between the two warring parties. And many civilians have already fled those areas into the neighboring countries, including southward to South Sudan, or in the west towards the Chad and the Central African Republic. So the new displacement is not surprise to many, but it could also be a huge increase on the humanitarian crisis, increasing already to the devastating situation in Sudan as well. So the warring parties has a lot to do still in that area, as they each and one of them is claiming to hold more territory and more ground on the battle.
And these local leaders or tribal chiefs also hold a huge significance in those areas and for the people there. So how might these death of local leaders and tribal chiefs increase the risk of long-term instability in these regions?
Yes, significantly. Previously, local leaders used to have a strong say in some of the political decision or some of the communal decisions in Sudan, especially in those regions of Kordofan and Darfur as well. But in recent days, some of these leaders have been manipulated. They've been politically, manipulated into different groups. If we can see recently the leaders that have been manipulated, and they have diverted their support, diverted their communal efforts and all, either to loyal to the military or to loyal to the RSF. Meanwhile, so they still have a strong say in those communities. But as I said, some of them have already been manipulated. So any kind of decision that comes out from them at the moment, it will be regarded by many communities as a political statement, as a political segment, because they want to be loyal. They want to be seen loyal with their all tribes, their all community. They are loyal to the government or to the military or to the rapid support forces. So in many cases, some of them at the moment have not even have any influence, because they don't want to see being loyal to either of the warring parties. So some of them remain muted, some of them remain silent due to the situation of the nature of the conflict in their area.
Thank you so much, Michael, for clarifying that. And lastly, with over 14 million people displaced and many people dead, what can international actors do differently to help end this conflict?
Okay, the major effort lays between the two warring parties. I mean, the two warring parties are Sudanese, and they are fighting in Sudan, and most of the civilians who are paying the price, who are displaced, who are killed, who are striving, they are Sudanese. So instead of waiting for international community to come and resolve a Sudanese problem, the major part lays between the hands of the two warring parties. Of course, diplomatically, the international community has to step in, the African Union has to step in, or the East African bloc like IGAD also has to say, or the Arab League, for example. They might have some say in between the two warring parties, but at the end of the day, the two warring parties are the major decision makers of when this war can stop. But at this crucial time, as the number of civilians or displaced civilians increase, a number of them are also striving in areas such as in North Darfur, in Al-Fashir. The international community has a lot to provide, like humanitarian assistance to the civilians, to ask, to plead with the warring parties to give a safe corridor for them, maybe to cross into Chad or to cross into the neighboring towns that are at least safe for them. As long as they remain in Al-Fashir, as long as they remain under shield, under a lot of bombardment between the warring parties, that is going to give a lot of casualties that wouldn't even be good for Sudanese or for the international community. So the international community at this moment, they can still have a say, they can still control some of the ammunition that are being imported in through the RSF or through the military, so that at least the escalation, the war can reduce, and then civilians now can have a better, safe place where they can go to their normal day-to-day life.
Yes, indeed. Thank you very much, Michael Atit, for joining us and sharing that insight from South Sudan. Thank you. Now we move on, but we stay in the region. Namibia's Ministry of Health has declared an outbreak of Mpox in the coastal city of Swakopmund. The outbreak was confirmed after the country registered its first case in the coastal city. The concerned patient is isolated at the Swakopmund District Hospital and is currently receiving comprehensive treatment. Responding to the outbreak, the ministry has activated surveillance, contact tracing, and response teams to contain the spread of this disease. Additionally, the ministry's Health and Social Services Minister has provided details of the first case, stating that a preliminary investigation links the outbreak to cross-border travel within the Southern African Development Community. Moreover, the identification of other cases is also underway in Swakopmund and the surrounding Erongo region. Now for this discussion, we're joined by Osanin Taivo. He's a policy and strategic implementation expert, joins us live from Abuja. Thank you very much for joining us again. Good to see you. Now looking at...
It's always nice to see you.
Thank you very much. And now looking at this news about Mpox, given the rising number of these outbreaks across Africa in 17 countries, is there a coordinated regional strategy or response that's going on right now, and what does it look like?
Okay, currently we have this current situation in terms of the spread of this virus, the Mpox virus, and outbreak in some parts of the Southern African development community. It's actually very important that this is not perfect from travelers coming in and out of the region who are actually traveling from Zambia to other parts of Malawi and Tanzania, and this part of the Southern African development countries, now from Namibia. And these are the things that actually really affect and make this Mpox disease actually spread around the African this region. It's actually very important that there must be some stringent travel policies and stringent travel rules to ensure that each virus is actually contained, at least to a large extent, so that you do not have a more polar situation whereby a lot of people would now start be infected, because these are contact sort of diseases, these are contact sort of viruses that may result in a lot of stresses from independent families to the external communities and what it is. So it's also very important that the health ministry of the Southern African development countries must take a cohesive position on how best to actually try to ensure that these diseases actually come at least to a larger extent. And this is not a responsibility, sole responsibility of Namibia, neither is it sole responsibility of any country that actually feels the outbreak, but it's sole responsibility of all the countries in the Southern African Development Community, because that is where this airborne disease is actually thriving right now. And because Africa is a very wonderful place, you have to be very careful, because before we know it now, we start seeing that in sub-Saharan Africa, some parts of Western Africa, some parts of even Northern Africa, and then it's going to become a kind of an African disease, and even go global if it is not properly considered and it's not properly called. So it is actually very important that this must be nipped in the bud immediately. Find the Namibian Ministry as raised an alarm. The patient is already in isolation, taking necessary medical treatment, but it's also very key that other parts of contact must be properly traced, and also those who have traveling in and out of the Southern African Development Region must also be properly tracked to avoid the widespread of this virus beyond where it is.
And furthermore, how can cross-border travel within the Southern African SADC be better managed to prevent spread of any infectious diseases?
So I want to believe that every region and every country has a very stringent medical framework in which every traveler must actually possess. Because first thing must be that we must actually have number one, a show of vaccine for certain viruses, like what was done during COVID. Everyone was allowed to travel unless you actually submit your COVID vaccine certificate or something like that. And then we must also go through this path as well, ensure that travelers are properly tested, and when any properly tested, we need on the spot results. So we do not have a situation whereby travelers are at the airport or maybe through land travels and then they are spreading this virus. So there must be a swift response from all the medical teams across this community, that's the SADC. There must also be a swift response from their medical team, and also we need further collaboration from medical personnel, both from the World Health Organization and other parts of the African region, to collaborate effectively to ensure that this is not a situation whereby it goes beyond the norm. Furthermore, it's also very important to understand that because of Mpox virus is not far-fetched from diseases that are connected to some sort of animals that people call wild animals in sort of part of the bush and whatever. So people must be careful on the kind of food they eat, and there must be proper orientation by the ministry as well to galvanize people around, educating them on the need to actually take very precautious health situations to their own to their own good, so that they avoid this kind of viruses and this kind of situation.
And what are the key challenges faced by public health systems in responding to these zoonotic diseases, especially in places of settings with resources limited in parts of Namibia?
Well, the truth of the matter is these zoonotic diseases are not far from one basic thing, which is characterized with appetite, which is poverty, because these zoonotic diseases are seen as the easiest way to actually get some sort of protein, and then people just go into the bush, into the zoo, get some kind of animal for them to actually get as protein for food. And also, so it's not far from the fact that poverty is one of the underlying factors towards this thing. And because it's also another means of making fast money for them, because it's lucrative, then you sell these animals, and you sell them, and if they are not properly processed, that's another key factor. If they're not properly processed, it also creates a kind of system that you actually create this kind of diseases. So in the resource of it, not only far from the fact that the health system in African region, in the African region, is also very it's actually below the international standard. Aside from being below the international standard, we cannot take it from the fact that the health workers also are not enough. because today we see a lot of brain drain, people going outside the shores of Africa, going to the likes of America, Europe, to actually for I'm talking about the medical practitioners right now, leaving the region of Africa for other parts of the world, and then creating a system that would actually create a gap, a medical gap in the African region. So those are the problems and the challenges that are facing the African region, and even these are not far from the Southern African Development Community as well.
Thank you very much, Osaniyin, for sharing that insight. Please stay with us as we come back to you. Now we stay in the region. The United Nations have stated that the last Ebola patient in the Democratic Republic of the Congo has been released from a treatment center in Kasai region. The World Health Organization, WHO, has said that the patient is the 19th to recover out of 64 total cases recorded since the outbreak was declared in September. They've also added that if no new cases are discovered in the next 42 days, the outbreak will be undeclared. The WHO's Director for Africa, Mohamed Janabi, has stated that the recovery was a remarkable achievement, has given the outbreak began in just 6 days. He has also added that the country's robust response with the support of WHO and partners was pivotal to this achievement. Now for this discussion, we go back to Osaniyin Taiwo. He's a policy and strategic implementation expert, joins us live from Abuja. Thank you very much, Osaniyin, for staying with us. Thank you. Now, as we were just talking about, as the international organizations who contribute to these kind of cases and help them, this I can say is a successful case. What do you think, what factors contributed to this containment of Ebola outbreak in particularly Kasai region, and what lessons can be applied for future outbreaks?
Okay, so firstly, I want to commend the Republic of Congo for DRC for their effective help in terms of spread of Ebola. It was recorded that about 64 patients that had contact with Ebola, and I think about 45 were reported dead, and then about 19 has been discharged from the hospital. And this is not far from the fact that there has been a swift response to this virus, and not only that, there has been a very good collaboration with the World Health Organization, who has been monitoring the situation since the past 42 days or thereabouts. And having said that, it is very important to understand that Ebola virus is not something that is just new in the African region, not particularly in the DRC, or it's been existing for almost over a decade right now, or even more than a decade. But this disease keeps on existing at some point in time. So the real question would be that what is the health ministry in DRC doing effectively to avoid the resilience of this disease? Number two is fine after 42 days, if there are no new cases, it could be things to be that Ebola has gone, because it has a window of about 45 days. And so for the past 48 days, there has not been any new report on any new Ebola virus patient. It is fine. But on the flip side, what is the ministry doing in terms of the country's Minister of Health doing to avoid a kind of resilience of this kind of virus? 42 days is a long time to tell it. You say, oh, Ebola is gone. And not only that, if you remember, if you check the United Nations, that's the WHO website, and their tracking of this Ebola virus, we realize that there are some cases that are yet to be reported in any medical facilities. They are not reported yet. Some people are even dead in their homes because probably because of fear of isolation, and some of them are even transmitted these diseases to close family members and friends. So it's still going to be a bit difficult to actually say that, oh, this is a situation whereby you can actually effectively say that for 3 days from now, you can say Ebola is gone and over in DRC. But one thing is very critical. The fact is that Africa and the World Health Organization must sit down together and think through on how best to cope with. Do we need a vaccine? Do we need proper rotation? Do we need certain drugs to be actually put into place? Do we need certain health orientation for citizens? Because the more we go, the more we try to say, oh, okay, the virus is gone, and then it resonates again, and then it's just like a pushback mechanism, and then there's really no final end to this. And this is quite dangerous to the African health system in general. So do we need an Ebola virus vaccine? Because at the long run, this is becoming more of like, the Ebola virus and this other disease, mpox and other diseases, is becoming more of like, excuse me, it's becoming more of like a situation like HIV and AIDS that are transmitted into the African region and even the global world. So we must take it to the board as soon as we can.
Yes, indeed. They need to sit down with local people and come to a resolution for a long time. Thank you very much, Osaniyan Taiwo, for joining us and sharing that insight as a policy and strategic